Over the 16 years that I've been working with breast cancer, I have realized that most of the women come very late. Prevention is the key. Most of them are not aware about the signs, symptoms, what they could do to pick up an early cancer. I searched a lot on the net and I realized that there's no episodes or a series or an encyclopedia on breast for a woman to be able to click on her fingertips and get all the knowledge she needs about diagnostics, treatment, surgeries, and other protocols internationally. Working with Dr. C.V. Kopikar, a renowned breast and oncoplastic surgeon, he has been acclaimed for his work in India, fondly known as the father of breast reconstruction and oncoplasty in India, having pioneered and brought reconstruction and oncoplasty to India, having had more than 2,000 cases today, the largest in the country, proud to say that. And I don't think I could know anyone better to be able to make this encyclopedia for the masses and the community. He is also on the board of the School of Oncoplastic Surgery in the USA and has professorship at the East Anglia in the UK, having trained more than 500 surgeons for reconstruction and oncoplasty. He is one of the pioneers in this field in our country. So I'm glad to have him with me today, and for a couple of series, till we completely close the series on breast diseases, benign and cancer, hoping that I would bring value to each and every one of you watching this, and it would be just at a click of your fingertips, detailed what happens to a patient when they walk into the clinic with a lump. What are the diagnostics? What happens with the mammogram? What happens with surgery, chemotherapy, radiation? What kind of biopsy reports come? What is the protocol internationally for a woman? And much more later on the holistic part too. I'd like to welcome Dr. C.V. Kopikar on this issue.
Hello. Hi. Good morning, everybody.
Hi, Anand. How are you?
I'm fine. I'm good.
Anand, thank you for accepting. And I'd like to start with you with a rapid fire round with just a yes and no.
Yeah.
If you have no choice, then maybe you could say a sentence, but ideally yes and no. Is early detection the most important factor in survival?
Yes.
Can men get breast cancer too?
Yes.
Is every breast lump cancerous?
No, not at all.
Does breast pain usually mean breast cancer?
Not at all.
Do women have to lose their breast when she's diagnosed with cancer?
A big no.
Does every woman with a fibroid and cyst have to undergo a surgery?
Again, a bigger no.
Can breastfeeding reduce the risk of breast cancer?
Yes.
Can a woman in her 20s get breast cancer?
Yes. To a lesser extent, though.
Many women feel that if she has a cancer and she removes her breast, the cancer will not come back. Is that true?
No, that's a myth.
Should a woman post-menopause continue to do a self-breast examination?
Yes.
Do black bras, red bras, underwire bras cause breast cancer?
No.
Is oncoplastic surgery both safe and effective for breast conservation?
Yes, very much so.
Can a breast cancer survivor lead a quality of life similar to the one she had before diagnosing her with cancer?
Absolutely yes.
Now I'd like to start with the pathway of for breast cancer and the patient's pathway with Dr. Kopikar in a very simple way to give you an overview in this episode about breast cancer. And from the next episode, we'll touch on every detail. So it's commonly known in India there are more than 2 lakh cases every year of new breast cancer. At the same time, breast cancer is known as the BEST cancer. Why is that?
So first of all, it can be diagnosed early very easily. Secondly, it can be prevented to a larger extent. And when diagnosed early, it is curable to the extent of at least 95%. So if it is diagnosed in the first stage, at least 95. And if it is diagnosed in the pre-cancer stage, around 98% of women will be cured from breast cancer, and they'll never get breast cancer again. So the key to the issue is, of course, early diagnosis.
Anand, it is often said that there are a lot of factors which a person can do to avoid getting breast cancer, like many other cancers, which are in their control, and some factors that are not in their control. Could you put some light on that?
The factors that are in their control is, of course, lead a very a life of exercise, of good eating, following the norms of nature. And for that I mean that you exercise for about 45 minutes a day for 5 days a week, which builds up your heart rate, that gives you a little bit of toning exercise, and you would avoid breast cancer by about 30 to 40%. You eat the right food, and the most important thing is to keep the weight under control. So you should keep a weight at that level which is recommended for your height and your age. So this is the this is the most important factor in trying to prevent breast cancer. And when I say it's what's are the following the laws of nature, first of all, get married early. Second, have a child before 30 years of age. Third, when you have the child, breastfeed her for about 9 months to a year. And basically, these are the laws of nature that you need to follow. So that will help you prevent breast cancer. And then, of course, no smoking and no alcohol. Because I know by saying no alcohol, there will be quite a bit of outrage everywhere. So I would say, if you drink alcohol, drink it in moderation. And it's just about social drinking that you could do. But regular alcohol would actually risk your chance of getting breast cancer. Now, there are certain things that unfortunately women just cannot avoid. And that is being born in a particular family that has a high risk of breast cancer. For example, there are a lot of family members getting breast cancer. And when it is possible, there is an abnormal gene in the family. Sometimes that abnormal gene is not even found on testing. But a strong family is one thing that you cannot. Second is the ethnicity that you begin to belong to. If you are a Caucasian, or in India, if you are, one of the either the Parsis or the Sindhi and the Boris and the Muslims, we seem to be seeing a little bit more of breast cancer in this kind of ethnicity in India. If you are in the other thing that you probably can't control is if you are in the urban area. Urban area, the women are more exposed to all sorts of lifestyles which increase the risk of breast cancer, and that lifestyle you can control, but you are amidst that, right? So that's one factor that is probably not totally in your control. The second is, when does a woman get her first menses and when she gets her last menses? So if this period is very long, and
menarche and menopause.
Yes, menarche is the first menses, menopause is the last menses. If this fertility period, as it is called, is extremely large, then a lady can get more predisposed to getting breast cancer later on. So these are factors that you really cannot change. And this is something that, all women have the risk of getting breast cancer because the breasts are also an organ that keep on changing throughout life. So they have a very avid influence of hormones on this organ. And any such organ which is very dynamic does have an increased risk. And therefore, we do get ladies who have been gym instructors, who have been athletes, who have been runners and doing marathons, and they have suffered from breast cancer. The only reason is that the organ is, with all the risk factors gone, a lady can still suffer from breast cancer, unfortunately.
Thank you. I also wanted you to touch upon, nowadays I find, especially in our country, over the counter, the I-pill is available. A lot of women are taking medication not to have children, and also hormonal replacement therapies, long period post the menopause because of the symptoms of menopause, that hot flushes and all that come. So would you also think that over a long term would be a high risk for cancer?
Yes, of course. I mean, this is one of the things that one can control. Any excessive use of hormones over a long period of time and consistently will increase the risk of breast cancer in women. So, even post-menopausal, if women have to take the estrogen pill or the combined pill, as it is called, it is recommended that they take it for a shorter period of time. So they could take it for maybe 3 years, maybe 5 years, but that would be the most, and then give it a break or stop it altogether. So if there is an acute need of it, then do it. Otherwise, if you can do without the hormone pill, it would be better. And for contraception, again, doing it for short periods of time, it is okay. But if it is a long, extended period of time, I would suggest other methods of contraception. And of course, the I-pill is probably one of the worst that one could do on a regular basis.
Dr. Koppikar, I've always heard you say that prevention is the main key, and it's very, very important to pick up the early cancer. And I've always heard you emphasize on how important it is for a woman to do a self-breast examination. So over these 16 years when I've been creating awareness and giving talks in the community, This is the single thing I have noticed, that the women do not know how to do a self-breast examination themselves. They think it's on their dry skin, and I know that, on the dry skin, you're not a trained nurse or a doctor. You'll find all your lumps and breast tissues and you'll get scared. So I would be very happy if you could enlighten the audience on when a self-breast examination should be done for a woman who's getting her periods, one who's menopaused, and how is it to be done.
See, first of all women should do breast examination. I would say they should start early in life, because
Around what age?
maybe 25, maybe 20. The reason is that as you keep on examining yourself every month, you know that how your breast feels in particular areas, and that is very, very important to know. And if there is any change in that area, one would pick it up earlier. So if a girl of 25 years of age starts it, by the time she's 35, 40, when it's really relevant, when, cancers can happen. By the way, breast cancers happen to a large extent in a age group between 35 and 45 years of age in India. So she would be very well versed with. So now the most important thing is, it should be done just after a period, the monthly periods. And it should be about
4 days post
maybe 3, 4, 5 days after the periods, when the breasts are the most supple. Now, what do I mean by that? That just premenstrually, the hormones are high, the breasts are being primed for pregnancy in case pregnancy occurs. And when it doesn't occur, the hormones drop, and that's why a woman bleeds. So when she bleeds, the hormones are at the lowest level. And then in about 4 or 5 days, the changes that have happened in the breast because of the high hormone levels before menses all drop and revert. So the breast become supple. And this is the time, if there are lumps, they will show up easily. So basically, if you do it before menses, the whole breast might feel lumpy, and a lump which is actually a suspicious lump may be masked with the, all the lumpiness that happens because of breast tissue. So now, how does a woman do it? It's best that she does it while having a bath, soaps herself, and then palpates the left breast with the right hand and goes all around the breast.
And does she use the fingertips or the base or the flat?
The flat of the hand, the middle part of the hand.
Not the fingertips and
no, and not between fingers.
Okay.
If you feel a breast between fingers, it will always be a lump, because it is a lump finally. The breast is a lumpy structure.
So you just glide your hand.
Yes. So
the soap breast.
Yes. The soap breast, if you glide your hand, it moves easily, and any abnormality which you have not felt before, so it may be a lump, it may be hardness like it's on the bone here, or it may be just a thickening of the breast, a little fibrous thickening which may not be as hard as this, but there is some change which you have not noticed before. Then you should look at it. And basically, don't stop at the breast. Also put your hand under the armpit and feel here, because there is a tongue of breast tissue that goes into the armpit too. So basically, that is how you would do the breast examination. Then stand in front of a mirror, look at yourself and raise your hands above your head. If the nipples move to the same extent on both the sides, it means it's normal. If the nipples move to a different extent, or a nipple gets pulled in, or there is a pulling in of some part of the skin on the breast, please see a doctor. It's not always that it will be a cancer, but it may be a little bit of fibrosis also, but it is best to be checked out. The next thing, you notice the nipple and see whether there's any ulceration or eczema. So it's very, very common for ladies to get a dry nipple, and then you get a little excoriation and you can get a little eczema-like situation. But this heals with treatment over 15 days. So, some moisturizing cream and some creams that a skin specialist might give you, and all this will be, will be much better. However, if this does not heal in 15 days, she needs to see a doctor, because this could be the first sign of breast cancer. And lastly, but not the least, squeeze the nipples and look for any discharge. Now, discharges are many, and most women might get a very innocuous discharge. By that I mean that it could be yellowish, it could be dark brownish, it could be greenish, and these are normal. Or it could be milk-like, milkish. So these are not suspicious of any cancer. However, if the discharge is either like water, or it is red or pinkish in color, bloody, then there could be a possibility of a benign tumor or a very early malignant tumor, which can be diagnosed very early. So basically, one should then see a doctor.
Thank you. And are there any other signs that she should look out for, like redness on the breast or a rash on the breast, or any other signs that
Yes, but these are signs which usually will come on at a later stage of breast cancer. So I would not wait for those kind of signs to come, that there is a redness on the breast or there is a little thickening on the breast, on the skin, and something like an orange peel appearance of the skin. These are actually very late signs of breast cancer. The early signs are the ones I described earlier.
So if she finds a lump, if a woman finds a lump, what is your advice to her? What is the first thing she should do?
When she finds a lump, she should first of all see a health professional who is trained in breast town, or she could go to her, a gynecologist and have a checkup done. Ideally, she should go to a well-trained doctor who examines breasts all the time, specializes in breast treatment, and then she should have follow the protocol which is then laid out by the doctor. The doctor will examine her and see whether that is a suspicious lump or not. So the next step would be to do certain kind of imaging. Now, suppose a lady is less than 40 years of age, we would do an ultrasound of the breast to just check whether that lump. So basically, remember, not all breast lumps are cancer. At least 90% of them are benign lumps. So if the lump is felt, it is non-tender, it's not a painful lump, it is a little harder, it's not moving very well in the breast, these are all signs that it could be breast cancer. That way the doctor will then further advise further tests. So if our patient under 40, doctor feels it's suspicious, the ultrasound will be done. If she thinks, yes, this is probably malignant, then he will advise a mammogram for a lady, even if she is less than 40. Following the mammogram, a correlation will be done between the mammogram and the ultrasound, and then a biopsy might be advised, which would be a very, very non-painful needle biopsy, which is done to decide what the cancer is. It a cancer or it's not? And in the middle of all this, sometimes the doctor might get, with the mammo and the sono, especially in younger patients, they may not, in about 5 to 10% of patients, may not elucidate the actual diagnosis. So what he may do, the doctor, he or she, will probably advise either a contrast mammography. Contrast mammography is a new kid on the block, but it is giving a contrast and doing a mammography. And like you do a contrast and do a CT scan, a mammogram is done, and that mammogram really differentiates between a tumor and the cancer very easily. A tumor to be either a cancer or a benign lesion. Or if that facility is not available, then the doctor may recommend an MRI. But if I'm given a choice, I would always prefer to do a contrast mammography because it has less false negative rates than a mammogram.
Interesting. You also mentioned that most of the lumps may not be a cancer. Many of them will be just benign lumps like cysts, fibroids, or so what can you explain a bit what is a benign disease?
So a tumor might be benign or malignant. So the benign could be just physiologically benign. That means the woman has lumpy breasts just before periods, and this would be just a lump. That means the breast, which has got stimulated by the hormones, has become a little more prominent, and then the patient feels that lump. So this is a absolutely physiological occurrence. So this is a benign lump which has, I would say it's a physiologically benign lump. Then the lady might feel a lump which is very mobile and which moves all over the breast. This is likely to be a benign lump. Now, what is meant by benign lump? This is actually either a cyst or a fibroid, or it could be certain other inflammatory conditions of the breast which need to be differentiated from breast cancer. For example, there is inflammatory mastitis of the breast. which is non-specific mastitis, or there is something called as granulomatous mastitis, or there is duct ectasia. That means in a lady, there are in a lady who is around 35-40 years of age, the ducts of the breast which dilate and become less, the elasticity is lost, so the secretions which are normally occurring in the breast are not exuded out. So these secretions collect in the duct and they create what is known as duct ectasia. So they can form lumps. It can form because of the secretions getting accumulated. You can get lumpiness around the nipple, you can get inflammation, you can get a painful lump. And so these are the benign conditions of the breast, which of course we'll go into much detail later on.
Episode specifically on each of these later.
Yeah.
So basically, these benign lumps that you mentioned, granulomatous and all these inflammatory lumps are not a cancer.
Granulomatous mastitis and inflammatory lumps are not a cancer, nor are they going to lead to cancer.
Yes.
The treatment is very, very innocuous. Most of these benign diseases don't need any surgery. So if a surgeon tells you, let's operate and biopsy this, that's wrong. It should not be done. In fact, in the Western world, if a lump without proper diagnosis with imaging, needle biopsy, or what have you, a lady is advised by a surgeon to do an excision biopsy or a removal of the lump for the sake of biopsy, he is liable to lose his license. So it is that serious a matter and taken very seriously by the international community. And I think the same should apply to India. So when a patient, you go to a patient, you go to a doctor and he or he examines you and says, oh, let's remove that lump. And if it is not a cancer, well and good. If it's a cancer, then it's absolutely wrong. It's not the right thing to do. It interferes with cancer treatment. If it was a cancer, in inflammatory disease, that is not the treatment. Sometimes in some inflammatory disease, it can worsen your prognosis. So basically, do not ever accept excision for diagnosis treatment.
That's very informative. And I find that in our country, very often women come with very, very painful breasts, very painful, and they feel it's a cancer. So could you shed some light? Have you had that experience in your practice?
I think around 70% of women who come to our clinic with very, very anxious, oh, I think I've got cancer, is a patients with painful lumps. And you can actually see how the transformation occurs when they are told. The first sentence I tell them is, if it is painful, it is not cancer. So don't worry about it. So that one sentence really relieves them. And so the most important thing is, just if a lady tells me I have a painful lump, 99% of the times this is not cancer. 1% of the times it could be. So I'm not saying ignore a painful lump, but you be assured that if it is a painful lump, it may not be a cancer. And this painfulness comes, as I mentioned alluded to it a little bit earlier on also, is because of the hormonal surge that happens just before the menses.
Yes.
And this increases the volume of the parenchyma. Now, breast has parenchyma in it, it has fat in it, and it has ducts in it to take the milk. The parenchymatous element is what produces the milk. That is increased because of hormones. And when it becomes increased, it becomes also very edematous. So the whole breast becomes tender. Now, it stretches in that whole environment. And because of it, it presses on the nerves and the breast becomes very tender and painful. Sometimes, due to these hormonal changes, cysts also happen. That means they are water-filled cysts, which are absolutely innocuous. And because they increase in size premenstrually, they again create tension in the breast and then cause pain. So basically, this painful breast syndrome is or it's called mastalgia in the medical world. It has got various reasons, but which are usually only benign, and only one type of cancer can produce a lot of pain, and is that which is called as an inflammatory cancer. Even there, the pain is not that severe. The redness and all is there of the breast. The breast can be very red, but not as painful as it would be in an inflammatory condition. And that is where you think, oh, is this inflammatory breast cancer and not just inflammation? So basically, the most important thing here is that all these painful conditions of the breast, other than the inflammatory breast cancer, are usually benign.
Benign.
They don't lead to cancer. They are not a predisposing factor to cancer. And most women, the pain will drop significantly post menses. But in some women, unfortunately, after many years of this up and down thing, the pain can remain constantly also. So don't be worried that, oh, now my pain has not stopped. So is that cancer? It is not. It is just that some of the not inflammatory, but the physiological conditions that have happened because of the hormones just persist during the whole period, and then they don't recede to the same extent in some other lady, and therefore they tend to get tender breasts even through the
You spoke about the biopsy. So, in case the biopsy result comes positive for a patient and she has a cancer, what makes you decide her treatment pathway?
So there are various things. One is the extent of the tumor, the size of the tumor, the age of the patient, of course, is the first thing. We also go into the history of the patient, whether she has a family history or etc., etc. So a lot of assessment is done on that score, because all of that, as we will go on to do the more detailed portion, we will tell you how it really affects it. Then we do she is diagnosed with a breast cancer, so we will also do special tests on that biopsy. The biopsy will be with a needle, of course, and through that needle we take about 4 or 5 pieces, which is painless, and then it is subjected to ER, PR and HER2. These are 3 tests: estrogen receptor, progesterone receptor and HER2 receptor. These are special tests that are done to help us decide how to treat the patient. Now, estrogen receptor means there are special receptors or special proteins on the tumor cells where the hormones of the lady is going to propagate her breast cancer. So the tumor cells are being encouraged to grow because of the hormones in our body, and it's called the hormone positive breast cancer. Then you have the HER2 positive breast cancer. Now there is a very special protein on about 25% of breast cancers in India, where you have a special protein which is called as HER2 gene. It is a HER2 protein which enables us to actually use an antibody. The scientists have discovered specialized antibodies against that type of cancer. Initially, when this cancer was found out, it was felt, this is a very aggressive cancer and patients were dying. But once the antibodies came forth, then the whole picture changed. Today, HER2 positive breast cancer is regarded as the most curable breast cancer. The third variety is the triple negative breast cancer. Now, this is an absolutely aggressive type of breast cancer. But again, doesn't mean it's not curable. Even it is curable in the earlier stages, but it is a more aggressive type, and unfortunately it is a type that is more prevalent in our country, the details of which we'll discuss later, and occurs at a age group between 35 and 50 years of age. And unfortunately in India, the largest amount of patients seem to be coming at that age. Our peak age is around between 45 and 49 years of age.
So now, once a biopsy has confirmed the cancer for a patient, what are her surgical options? Because, I have seen when I started working with the cancer patients 15, 16 years ago, there was only basically mastectomy. And most of the women were very scared to come when they had a lump and show the doctor because they thought they would lose their breast. It involves her self-image, her sexuality, her body image, everything. So she was extremely scared. Then over the years, I have seen you pioneering oncoplasty and breast conservation and reconstruction. And I think with this pioneering and training more than 500 surgeons that you have done in our country, and people have come from all over the world to train with you. And of course, those people have trained more people. So it's been a ripple effect. And all over the country, I've seen the rate of mastectomy has gone down and the rates of conservation have gone higher. So what would you say is the options the patient has for surgery?
So first of all, there were always been, over the century. So, when it started in the early 19th century, the real documentation of breast surgery, it was felt that removing the whole breast along with the muscle and the lymph nodes, and even they went on to cut open and remove nodes from inside the chest and all of that. So that was an option. Then came where we did a modified mastectomy, that we removed the breast and left the muscles behind but removed all the lymph nodes. Then came breast conservation surgery. So over the years and over this whole century, the treatment has completely turned around 180 degrees, because it's absolutely the reverse path today. The option of mastectomy of any kind is not the best option for any patient. In most centers and which practice breast surgery, at least minimum of 80% of patients are treated only with breast conservation, and the reason is that mastectomy, even if it is of the more conservative type of mastectomy where we don't remove the muscle and all, leads to a disfigurement that the woman is not able to tolerate and gets into a depression, and could lead to a very poor quality of life going forward. Her social, the social quality of life, as you call it, and then you call yes, and basically I've seen marriages breaking because of this, and there have been a lot of issues with mastectomy over the years, and it was thought that removal of the breast was the best option. But today we know that actually breast conservation surgery not only saves the woman the indignity of losing a breast, but also may be curing better. Now, why
touch upon for the common person, what does breast conservation mean?
Breast conservation means the breast is saved. It is not removed with a mastectomy. That means the whole breast is removed. It's not removed, it is saved. And as the results have shown today of various studies that have come forth, that actually breast conservation may be better than mastectomy in saving lives. And that has been shown in repeated cohort studies. That means, studies which have taken, and this is not the highest level of evidence, but lakhs and lakhs of patients, about 15 lakhs and more patients have been compared to a mastectomy, and 5% better survival. So it cannot be, just an episodic thing. It is definitely seems to be that breast conservation may be curing better. There are proponents and some people argue about that this is not a very good way of studying things, but whatever it is showing better results. And finally came a new kid on the block, which was called oncoplastic breast surgery, and that was very important because just removing a lump, leaving a bad scar on the breast, seemed to give just as much depression to the woman as a removal of the breast, because she saw that scar every day. That scar, the breast didn't look normal, and then just having a mound there but absolutely defaced was not the right approach. So oncoplastics came to being around the early 2000s and late 1990s, where we actually started reconstructing the breast after a lumpectomy, so that the breast looked better, in fact, after surgery, or at least as good after surgery. The scars were hidden, the tumors were removed where you couldn't see the scar. So when the women had very large breasts, we reduced them and created a mound which was perky, and the woman was actually, when we did the studies now, a woman's quality of life, which is low because she has very large breasts, jumps to being extremely high after this surgery in breast cancer, because she is not only cured, but she is leading a much better life with young, perky breasts. So that's why oncoplastic surgery came into being. And lastly, reconstructive breast surgery. That means there are 10 to 20% of patients where we just cannot save the breast for certain reasons, which we'll come to later. In those patients, an immediate reconstruction can be done very nicely by using the breast, using the lady's own tissues or with implants. And that has also increased the acceptability of cancer treatment. Why I'm using this term? Women shied away from diagnosis because they thought they were going to, first of all, die of the disease, which is a myth. Second is that they felt even if we don't die, we'll be living a life where we have no breast.
Mutilated.
My husband may not look at me again. I might lose my marriage. I might, in society, how do I move around without a breast and things like that. So basically, that was the reason why, may have been one of the major reasons why women didn't come for early diagnosis. Today, they know, when they know that it's actually about even bettering the looks of their breast, they probably will come for earlier diagnosis.
You've had a practice of over 35 years as a cancer surgeon in the country, and you've been among the pioneers to bring in oncoplastic surgery in India with over 2,000 cases. And I think that's the largest number in the country, and that too for a single surgeon. So it's phenomenal, the work that you have done, and trained so many surgeons all from all over the world who still come as fellows to you. I wanted you to touch upon a little bit on oncoplasty. What does oncoplastic surgery mean for the layperson? And also, like when a patient has an oncoplastic surgery, how many days is she in hospital? When does she go home? And is her quality of life as good as than before she had surgery?
Yeah, the term oncoplastic surgery means onco is the removal of the tumor properly. That means sometimes the tumor is larger, sometimes the tumor is multiple. So you remove that area of the breast, where the tumors are very well. We will of course describe this better in our episode on oncoplastic surgery. Yes. But because there are various ways in which we decide how much breast tissue to remove, and that, these pre-surgery tests help us, like contrast mammography, and then the breast is reconstituted with the help of surrounding breast tissue to form as good a breast as before, or maybe better. There are various types of surgeries for the small breasts, for the large breasts, and for the medium-sized breasts and the ptotic breasts. So various surgeries where you remove the tumor and do a plastic surgery procedure. A lady definitely, his quality of life improves after that surgery is done.
And she is in hospital normally for...
She stays for only one night.
Oh, lovely.
And that too, most of the time dictated by the insurance company.
Because she has to spend a night over.
Yes. Otherwise, she could even go home the same evening.
Isn't that marvelous today? Because, we all know whatever the disease is and whatever the surgery is, the moment the patient goes back home, the healing is much better.
Yes, and there is, these being very surface surgeries, over the body surgeries, is not usually any complications.
Yes.
So basically, they are seen in the evening. If they are not got an insurance, they can go home and relax at home and recover better. Staying in hospital for longer periods of time is not the best thing for any patient of breast cancer. You can acquire hospital-based infections, you can acquire other issues, and the most important thing, like you said, the lady might feel much better at home in her own environment.
So if I understand right, oncoplasty means removal of the cancer at the same time where you reconstruct her breast to look better than it was when she went in for surgery, because most of the women are above 44 years old and there's a bit of sagging. So she wakes up from the surgery, the cancer has been removed and the breasts have been perked up and made to look better. And that retains her self-image, her body image, keeps depression at bay and helps a better long-term survival.
Absolutely.
I had a question. If there are women who come who already had a mastectomy somewhere else or in another city or something, and then they think that, I wasn't offered reconstruction or oncoplastic procedure, can she have one later?
Yes, she can have a reconstructive procedure later, though it will never be as good as when it is done at the same time. Right. So we always try to do breast reconstruction at the same time of the surgery. So it should be, but it's definitely possible to reconstruct her later on in life.
And of course, the other two pathways are chemo and radiation. And as I hear and see now, the chemotherapy medicines are much more smoother, so there are much less side effects. So could you touch just very shortly on that? We'll be doing a full episode on that, and a little bit about how important radiation is.
Yes. So chemotherapy has changed a lot. There are much more refined drugs today. There are also new drugs which have lesser side effects to some extent. But more than that, the drugs that are supportive, that reduce complications, are less. And remember, the word is today less is more. So you are trying to give less of everything, less of surgery, less of chemotherapy, and less of everything, and cure as much or better. So less is more is the dictum today. So chemotherapy is now very well tolerated. It is in the daycare. The patient doesn't have to be admitted. Patient goes home in 4 or 5 hours and relaxes at home. The chemo is given in a nice environment where the patient sits and takes the chemo and goes home. So it's a very easy process to take the chemo. The side effects which occur are also much better controlled today, and therefore, it's not the thing of the past. We hardly see a lady ever vomiting. The next is radiation is a must for all patients who have a breast conservation surgery. Sometimes it's needed even after a mass removal of the breast. But again, the radiation quality has improved to such an extent that it can be very well targeted to the area where you need to do it, and therefore all the vital organs are spared. Some women we give radiation in only 5 days. So it's only a 5-day visit to the radiation center. And in some women, we give it for a maximum of 15 days. So it is between 5 to 15 days is all the time. So the time in the past used to be 6 weeks, has come down to just about 3 weeks. That is over 15 days. So 5 days a week for 15. The side effects are minimal, and the patient really doesn't suffer at all.
Thanks. A lot has been spoken now in the last few years on genetics and genetic cancer. Very often a woman feels that if her mother or her sister or somebody in the family had a genetic cancer, that she would also get it. Is that true? And what is the role of a genetic testing prior to surgery? Do you think it plays an important role for you to know that a patient has the genetic predisposition? Would the outcome of the surgery, what you decide, make a difference?
So that's a really big topic to discuss. I think let's just get to the bottom of what is genetic testing. So I think as of today's recommendation, all women who have that triple negative breast cancer I spoke about must have a gene testing, because about 5 to 12% of women who suffer from breast cancer will have a abnormal gene. And this triple negative variety, even if there is no family history, sometimes we'll end up with finding a patient first time in the having breast cancer in the family having that gene. So genetics is important, because there are a lot of medical issues for the patient. For example, some special drugs can commit force when a patient has a genetic cancer. Surgery, if the patient is young, very young, and has a very early breast cancer or a pre-cancer, one may discuss with her the options of surgery, which are, something like what Angelina Jolie did, of a bilateral mastectomy with reconstruction. But as we know today, it is not a must to have it. It does not cure better. It only reduces the incidence of new breast cancers in that patient. So yes, certain surgical decisions might be affected, as well as certain medical decisions could be affected. So it's important, and then it has a bearing on the rest of the family. If a lady has a gene, BRCA gene or an abnormal gene, 50% of her siblings are going to carry the gene. So they will need to be counseled and, put through a rigorous prevention program with exercise and, all those sort of factors.
We will be doing specific series on genetics and radiation and chemotherapy in detail to answer all the questions. So this is an overview of the entire pathway for the patient. But once the treatment is over, in very short, could you let me know what does the patient's follow-up look like? So, like how often does a person need to come for an annual mammogram or a regular checkup? How often would you call the patient post-surgery?
So, as per norms, as per international recommendations, after a surgery, patient comes, depending on how aggressive the tumor was, etc., either every 3 months or 6 months for just a clinical checkup. And at the end of the year, she has a mammogram, and in most of the younger women, also ultrasound of the pelvis. So these are the two tests that are usually done on a screening sort of basis at the end of every year. So a mammogram is repeated every year. So in some patients who are very young, we may add either a contrast mammogram or a MRI. So that is the usual way of following up the patient.
You have often told me that the most important thing is the quality of life of the patient when you look at the treatment. So I feel when I'm hearing you today, would you say that the patient could retain her quality of life as good as it was before once her entire treatment is over?
Yes.
And is that what the aim is today for treatment of breast cancer?
Absolutely. So today's aim of treatment, as described by all the peers and who are, what have you, all the organizations, fighting breast cancer, is that less is more, and that quality of life needs to be maintained during treatment and after treatment.
Fantastic.
So basically, the surgeries, the radiation, the chemotherapy, the other adjuvant therapies, which you see, this adjuvant word I've just brought in, but we'll describe later. Adjuvant therapies are the chemotherapy, the radiation therapy, then there is hormone therapy. In the estrogen receptor positive patients, you give anti-hormonal therapy to prevent the cancer from coming back. So once the surgery is done, the patient is cured. But we don't want it to come back. So you give all these adjuvant therapies. So combine all of this. You need to see that the quality of life is maintained throughout all of them. And we have seen definitely that the quality of surgery, from mastectomy to oncoplastic surgery, there is a huge difference in the quality of life between those who have had oncoplastic breast surgery versus those who have had mastectomy, or those who have had mastectomy with reconstruction, or those who have had just breast conservation surgery without mastectomy. So oncoplastic breast surgery is probably the one that has given the most important improvement in quality of life. The next is the chemotherapy, which is again being tempered so as to suit the patient's overall diet, the makeup of the patient, her weight, her body weight, her her comorbid conditions. So the chemo is very well with a good intelligent medical oncologist. You can temper the treatment to suit her and also have equivalent results. The radiation, by a good radiation unit with high quality precision physics, can give radiation that can really will not harm the patient. So all this, and on top of that, which we shall speak of much later on, is the holistic care.
I was just going to come to that as my last question. So at your center, at Orchids Breast Health in Pune, over the last 15 or 16 years, I've seen it as one of the most comprehensive breast centers in the country. And it's been a standalone center for breast, where not only the diagnostics and the treatment and the chemotherapy and everything takes place, but the most amazing part is that there is free counseling for every patient. There's free nutritionists for every patient. You have a huge support group. There is yoga, there is alternative remedies. You also involve homeopathy and things like that. And also a lot of genetic counseling and many other holistic things together. It's under one umbrella, and it's offered completely complementary to your patient, because I understand when a patient in India comes in for treatment, every little rupee that they have is saved for the whole pathway of treatment. They do not want to spend that kind of money on counseling for the family caregivers and for nutrition, which you would give it to them free. So how important has this holistic part been?
The holistic part is very important in any disease, I feel, because unless the patient has good counseling, nutritional counseling, psychological counseling, genetic counseling, and they come in at various phases of treatment, they will definitely be useful to give the patient again that quality of life that is important.
Thank you so much. Thank you, Dr. Kopikar, for being here with me today and giving a complete overview. I'm looking forward to many series to touch upon each and every topic that we have discussed, and hoping to make an encyclopedia online for our country and for a reference. Thank you very much for spending this morning with me today.
Thank you. My privilege.